Hi, I'm Dr. Max Lingenfelter. Welcome to our video on what exactly is a knee replacement. I like to say that the term total knee replacement is really a misnomer. It should be called a knee resurfacing because most people, when they hear the term total knee, have the concept that you're taking everything out from the thigh to the shin and replacing it with a mechanical hinge. In reality, we're trying to do exactly the opposite. We're trying to remove as little tissue as possible while still achieving our goal. So this is what a knee replacement looks like. We are simply removing only the damaged bone and replacing that exact amount with titanium. Between the two titanium components goes polyethylene, which serves as a space-age plastic and artificial cartilage. This is performed with robotic assistance, which allows maximum precision and custom tailoring of every knee replacement that I perform. I am still controlling the surgery and performing every aspect individually, but it is done with robotics, which allows precision down to half a millimeter or 1 degree. Preoperatively, a CT is obtained of the knee, which enables us to build a computer model of your knee and perform the surgery virtually weeks before the operation even occurs. This means that we know about 98% of the information to perform the best possible knee replacement for your unique anatomy, and the last 2% will be measured while we test this model on your live physical knee prior to initiating the operation. This results in a much more different experience than would have been possible with traditional approaches and traditional techniques. Robotic assistance allows us to calculate the minimum amount of bone to be removed to achieve our goal, and bone cement is now often not needed. Our patient's ability to regain full extension and flexion is greatly aided in this personalized balancing approach, which is adjusted for each individual patient based on their unique anatomy. It also allows us to utilize a much smaller incision. So this is an example of a preoperative plan obtained from a patient and us calculating the exact orientation and placement of the knee replacement to optimize their outcome. And thus by doing so, we turn a knee that looks like this on the left into something that looks like this on the right, where preoperatively the bones are grinding on each other. They are now insulated from one another and can no longer touch or cause friction or irritation or pain. It takes a knee which is bent and crooked on the left-hand side from arthritis and makes it perfectly straight and balanced on the right. At the conclusion of the operation, the field is closed in a multiple layer fashion to make it strong enough to tolerate range of motion immediately following surgery. This is performed by what's called a plastic surgery closure, meaning there are no sutures or staples on the surface of the skin. All sutures are buried underneath the skin and dissolvable. About 98% of patients will never see their sutures at all. It also means that there are no sutures or staples to be removed at your postoperative visit, which results in a much more pleasant experience. The skin is then covered with a two-tiered bandage system. First, an adhesive layer is applied directly to the skin. Secondly, a barrier or bandage is applied on top of this. This results in 3 solid layers protecting our surgical site. Can I shower following surgery? This bandage, which is placed at the conclusion of the operation, is water resistant and should allow showering immediately following surgery, unless otherwise specified by your surgeon. Following a knee replacement, I would suggest wrapping it in saran wrap or a plastic bag to prevent fully saturating the dressing while showering. You can also use a directional shower head to help avoid spraying water directly onto the bandage, as this can result in the bandage peeling up around the edges. Should I see drainage on my bandage? You may see some drainage on the bandage. This is normal and not to be concerned about. This is a normal part of the healing process and will be changed at your postoperative visit. These bandages are specifically designed to wick away moisture from the skin and healing environment and trap it in a polymer inside the bandage and keep this environment sterile. If, however, the bandage becomes saturated the entire width of the bandage, or if there is leakage from the bandage, you should notify your care team for a bandage change and direct attention. Please leave your bandage on until being removed by your care team in the clinic. Patients always ask, what can I do to get ready for surgery? And the answer is prehab. You can go see physical therapy once or twice to learn the exercises, or you can simply begin your own home regimen. The most important exercise I would recommend is the straight leg raise. Studies show the stronger you are beginning the procedure, the faster and better and the ultimate outcome will be. And by doing this exercise, you will strengthen your core, your hip flexors, and your quad, which are all the muscles that will be required to walk confidently following the joint replacement. This can be performed by laying flat on your back, and imagine someone's hand is 2.5 feet in front of your toes, and you have to kick their hand with your toes about 60 times. You should be able to do this 2 or 3 times in a day, and when that becomes too easy, add some ankle weights. That way, you'll hit the ground running with your recovery. The second exercise I would recommend, which is even more challenging, is the half squat. You simply bend at the knee and go about halfway down and come back up. You can hold onto a bar or chair in front of you if needed for additional support. This will also greatly help strengthen your quads. Some patients with extreme arthritis simply can't tolerate this motion, in which case you should focus on the first exercise. Many patients ask whether or not they can go home the same day of their surgery. And yes, the majority of patients can go home the same day they've had a hip or knee replacement. Actually, this is about 80 to 90% of patients. The reasons that someone would not be able to go home the same day are summarized below. Age greater than 80, significant cardiac, pulmonary, or renal history, diabetes which demonstrates difficulty for tight blood sugar control like an A1C greater than 7.5, an inability to ambulate and clear the physical therapy evaluation following surgery for discharge. This could be someone who requires a walker or wheelchair prior to surgery, indicating they have increased assistance needs following surgery. Any history of stroke or heart attack within the last 2 years. Any history of a bleeding disorder or anemia would be reasons you would likely need to stay in the hospital overnight for observation. This is a generalized list. This decision should be discussed with your surgeon, your primary care physician, and any specialists that care for your chronic medical conditions. When patients ask how long I need to be off of work for joint replacement, as with most things in medicine, it depends. I do have some self-employed patients with purely desk-type work who have had surgery on a Friday and went back to work on Monday remotely, but I don't personally recommend that. I recommend that if you have a sedentary desk job, taking 3 to 4 weeks is a reasonable timeline, with the understanding that you will still need Tylenol and ibuprofen during this time with frequent elevation and icing. If you have a job that requires long periods of walking or standing, such as teaching or sales, I would recommend waiting 6 to 8 weeks, as these long periods of standing can be uncomfortable earlier on in the healing process, and you will still want to ice and elevate following work. If you have an extremely physically demanding job like factory work, construction, or police officer, I would recommend taking a full 12 weeks to make sure that you are physically ready. It does usually take 3 full months for the stabilizer muscles around the joint to be fully strengthened and tuned up for this type of work. This has been our video on what exactly is a knee replacement. Thank you for joining. I hope it was helpful. Please like and share with friends and family who may benefit as well. Please stay tuned for our next video, which we will go over the recovery process for a knee replacement surgery. As always, thank you for joining and have a nice day.